Imagine that one day you receive a pill which your doctor claims is a revolutionary medication for your condition. You take it with hope, and in just a few days, your symptoms are significantly reduced. Later, you are surprised to learn that the pill contains nothing more than sugar or another inert substance. How is it possible that your body responds so powerfully to an illusion? This is the power of the placebo effect and the fascinating subject of this video. Let's get started. The term placebo. The term placebo originates from Latin and translates as "I shall please" or "I will make myself pleasing." Initially, the word appeared with a different meaning from the one it has today, as it was first used in a religious context. Origins and early uses. The earliest documented references to the term placebo date back to the Middle Ages, when it was used during funeral services in the Catholic Church. In the 12th century, placebo domino in regione vivorum, meaning "I shall please the Lord in the land of the living," was an expression from Psalm 116, laden with spiritual significance. Later, the term came to describe a person who sought to flatter or ingratiate themselves in order to obtain favors. It was not until the 18th century that placebo was adopted in medicine. Doctors used this term to describe apparently inactive treatments given to patients to calm their anxiety or to induce a state of psychological comfort. Use in medicine and research. The first documented medical use of the term placebo dates back to 1785, when it was included in a medical dictionary in England, where it was defined as a medicine given more to please the patient than to treat their illness. During that period, placebo treatments were frequently used in medical practice, particularly for patients who were obsessively preoccupied with their own health. In the 20th century, the placebo concept gained major importance in clinical research. Controlled randomized studies using placebo as a reference point became the gold standard for evaluating the efficacy of medications. What is the placebo effect? The placebo effect represents a positive change in an individual's health status induced by the belief that the treatment being administered will be effective even though it contains no active ingredients. For example, administering a sugar pill to a patient who believes they are receiving a potent medication can result in symptom relief. This effect is not limited to pills. It can be induced by any intervention perceived as therapeutic, including injections, medical procedures, or even simple verbal suggestions. How does the placebo work in the mind? The mechanism behind the placebo effect is closely linked to our thought processes and personal beliefs. When a person believes that a treatment is real, the brain can release chemicals such as endorphins and dopamine, which help reduce pain and enhance well-being. Brain scans have shown that the placebo effect activates regions of the brain associated with reward, motivation, and pain processing. This demonstrates the power of positive thoughts and expectations on the physiology of the human body. Famous examples of the placebo effect. Henry Beecher's study. During World War II, the American surgeon Henry K. Beecher ran out of morphine. Toward the end of the war, morphine was available only in small doses in field hospitals. Dr. Beecher observed that wounded soldiers who were given saline solution instead of morphine reported pain relief simply because they were told they were receiving a powerful analgesic. Placebo surgeries. In the 1950s, patients with angina pectoris underwent sham surgeries, and many of them reported a significant improvement in their symptoms, even though no real intervention was performed. How powerful is the placebo? Studies show that the placebo effect can be extraordinarily powerful. However, its efficacy depends on several factors. Patient expectations. The more convinced a person is that the treatment will work, the stronger the placebo effect will be. Medical context. The way the treatment is presented, for example by an authoritative doctor or in a well-equipped hospital, can amplify the effect. Form of treatment. Colorful pills, injections, or sophisticated therapies tend to have a greater impact than plain ones. Benefits and applications. The placebo effect is actively used in various fields. Pain management. Placebo treatments have demonstrated significant efficacy in alleviating chronic pain. Mental health, placebo therapy can reduce symptoms of anxiety and depression. Sports, athletes who believe they are receiving performance-enhancing supplements may experience a real increase in strength and endurance. Limitations of the placebo effect. Although it has impressive benefits, the placebo effect cannot replace real medical treatments for severe illnesses. It is essential to use it ethically without deceiving patients or compromising their trust in the medical system. The placebo effect is evidence of the power of the human mind over the body. From its religious origins to its use in modern medicine, it reminds us that positive expectations and beliefs can have a profound impact on our health. Understanding this phenomenon opens doors to new ways of approaching healing, emphasizing the deep connection between the mind and the body. However, one captivating question remains: how much can we harness this latent power of the mind? This is the enigma that continues to fascinate and inspire science.